So we squeeze, 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 squeeze. Oh, I see a little blood vessel on there. Yeah. Right. Hold it like this. Hand in and then out. Right? So the needle technique again. I'm not doing it yet. In and then out.
Can you show it with a pen? I think for them, they can see better than they cannot see
Yeah.
the needle at all.
So again, here. Holding it this way first, moving up, and then out. That's the hand technique. The same one we demonstrated earlier today. Okay? We can actually see some faint blood vessels in that area under the skin. It's not a blood vessel, it's area of venous congestion. Squeeze, squeeze, and that comes out more as we're squeezing it. Okay? Squeezing is worse than the puncturing. Did it hurt?
No.
See, I told you.
You were right.
Doesn't hurt. She's like, it hurts. I'm like, no, it doesn't. On the trunk, you will have to squeeze a little more. Okay? And then if there are more, we could technically do maybe one or two here, one or two further down the line. But this is the area where I saw most of the venous congestion. Right? And already the blood's turning a little lighter. Okay?
So if you puncture deeper, you wouldn't have to squeeze as much. But you don't want to do that, right?
It's not deep. It's wide. So it's not how deep, it's how wide. So this was, in the absence of major pathology, this is an appropriate amount of blood.
Appropriate.
Yeah.
Okay.
That's 1 drop each. That's 1 or 2 or 3 drops from each point. That's good.
So for health maintenance, anti-aging, would you do this
Health
once
maintenance,
a month?
anti-aging, do exercise. Maksa andusan, I maximize dusanli, especially in the cold weather, because I'm half Italian. My ancestors were not designed to live in the northeast of the United States.
Come live here.
Yeah, except I'm an East Coast kind of guy. You guys don't have the grit that New York has. I have to be more stressed out. I can't. It's too relaxing here. Too much sun.
You can be more rude.
You have to be ruder to me, yeah. You guys are too nice. Donna brought me a cookie this morning, and no one in New York will bring me a cookie. All right?
Can you do this kind of method for frozen shoulder?
For frozen shoulder, we're bleeding points on the lower back or bleeding lung 5. Okay?
Oh, okay.
But that's what it looks like bleeding the trunk. Okay? All right? Just so you have an idea of what it looks like. And then the trunk, I mean, in some patients, you will see blood vessels. Right? They're not going to be as dark or as obvious as bladder 40, in which case you may not have to do the squeezing. But more often you'll have to do the squeezing for this type of area. But still worked. It's good.
Do you have any thoughts on what makes a hematoma sometimes and not other times?
Yeah, so the question is what makes a hematoma sometimes, other times. My opinion, and I mentioned this briefly in the book, is that if we have a hematoma that forms immediately upon puncturing, it's almost like the blood vessel goes whoosh, and very little comes out. To me, this is a sign of internal dampness, right? Where there's still accumulation of maybe damp and cold that doesn't allow for the complete expression of the blood, right? Because it creates swelling. Swelling is related to spleen, right? That's my opinion. So I had one patient, the first time, this was like an aha moment for me. I had this patient who has this very typical like wind damp headache, right? Whenever the weather changes, when the front comes through, she gets a migraine. So I bled her ear apex, and she looks damp, right? She's like, you know, what's the formula? Changhuo Sheng Shi Tang, right? That's her. She looks like that formula, right? And it works for her. But I remember bleeding her ear apex and immediately got a hematoma on the ear apex, and I thought, what the hell is going on? And then it's like, aha. I had read something. The chapter in the Ling Shu talks about this briefly, not explicitly, but I think this is what we're seeing with this. So when someone gets that, in my book, it's more of a sign of internal damp cold accumulation, right? Okay.